You're live.
Hey guys, it's Dr. Emer, and we are here doing some acne scar treatments. One of my favorite treatments for ice pick scars, you guys can see if you take a look here with the side light. I'll bring this over a little bit, let me show them. You see these enlarged pores, sort of deeper but thin scars. These are called ice pick, and to improve them, we have to damage the walls around them to get them to cave in on themselves, which is why we're doing something called TCA Cross, which is a little chemical, not a little, it's actually a strong chemical, but we use it very carefully in areas where there are scars, these deep scars. Now she doesn't have a lot of them, but they're substantial enough that we want to make sure we really get the edge of these walls. We're going to start with this process first. Her overall goal today is to get as much improvement as possible. So we're going to volumize part of her mid-face to give collagen production and lift using Sculptra. We're going to do TCA Cross. Turn your head to the left a little bit. Some of these ice pick scars. Now, this bigger, broader scar right here, we don't want to go too much on this one. Keep your eyes closed just a minute. We're going to go around. This is what I call TCA paint. We're going to paint the edge of this scar so that it kind of caves in on itself. Then we're going to do lasers for both the texture and the color. We're going to use a vascular laser called the XLV for her redness, and then halo and ProFractional laser for the scarring and texture. I do that treatment myself every 3 or 4 months. But we're going to go super strong for her today to do her scarring. What were you going to say, Will?
Could this work on stretch marks?
Not really, but you know what works on stretch marks really well, and I haven't shown you guys yet? The plasma pen. So eventually we'll talk about plasma pen for both stretch marks and self-harm scars or mild scars on the arms that are white. Plasma pen works phenomenal. So take a look, you guys can see now, look. The walls of that scar now have that white frost. This is the super strong acid working. That's why you want to have, Rosa, what do you need when you do TCA Cross?
Patience.
Patience, because it takes time for the treatment to work, which is why I'm going really slow. And I'm being very generous and careful. And, you know, I've been doing this a long time, you guys, about 14 years. And even then, no one was doing this treatment. What I want to tell you is don't go buy an acid and put this on your skin at home. I've seen numerous DIY TCA Cross gone wrong, and it's not good. It's like skin gone wild. It's not good. You don't want that. So this all looks great. This is exactly how we want it to be. A little red at the edge like you see there, a nice white frost, turn back left, and just taking a look at every angle. Shine up from here. Perfect. So you guys see the edge of that scar? We're now getting the edge of that scar. Perfect.
Aya says, I hope one day you can come visit us.
I would love to. Where are you? Gotta find out where she is. Okay.
How often do you need to repeat this for the best results?
Well, it just depends on each scar. Usually at a 4 to 6 week interval until we're happy. Some scars really can't fully go away with just this. That's why we also laser. So she's doing great. This is the TCA part. I just wanted you guys to see that. And now we're going to go into our next phase for her redness and for the volumization. We'll be back.